Compliant Coding Systems Coding Academy welcomes you to Trumping in HCC Risk Adjustment. We're often asked, what is trumping? Some of us who play cards may associate the term of trump with the game of bridge, where trumping means something regarding the playing a card of a suit that for an out time ranks other suits. There's other definitions. It means to excel or surpass or outdo, and to supersede in rank, value, or importance. And in regard to Medicare risk adjustment and HCCs, it's that final definition that's applicable. So let's take a closer look at what trumping is. How does trumping apply to HCCs? In the Medicare HCC model of risk adjustment, there are 25 base condition categories. Remember, the term HCC stands for hierarchical condition category. These 25 categories are listed below. They include infection, neoplasm, diabetes, and so forth. The 25 condition categories are distinct. What this means is that the categories are unique and the categories are additive as categories, meaning that any condition belonging to a particular category will carry a value that is included in risk score calculation in addition to conditions from any other category. These categories are subdivided into 79 HCCs, where certain categories have several subcategories. These subcategories make the hierarchies in the term hierarchical condition categories. Let's look at an example. The category of neoplasm is divided into 5 subcategories in a hierarchy. As you can see from the inset, HCC 8 through HCC 12. HCC 8 is metastatic cancer and acute leukemia. HCC 9 is lung and other severe cancers. HCC 10 is lymphoma and other cancers. HCC 11 colorectal, bladder, and other cancers. And HCC 12 is breast, prostate, and other cancers and tumors. So the category of neoplasm and any diagnosis within the category will carry a risk score value that will be added to any other category that is present. However, if more than one diagnosis within this category is present, then only the diagnosis with the greatest value will be counted. Let's take a look at an illustration of 2 diagnoses in a hierarchy. And we're going to take actually a look at 2 different condition categories in our hierarchies. And today we've selected neoplasms and diabetes. So we will we'll present documentation scenarios for these 2 condition categories in the following slides. And for today's purpose, we'll assume that they are for the same beneficiary in the same review period. The first of which is the neoplasm category. So let's assume that on March 12th, the record for this patient indicates that a patient is treated for prostate cancer, which falls into HCC 12. On June 16th of the same review period, the patient is diagnosed with metastatic lung cancer, and that maps to HCC 8. Both diagnoses belong to the same condition category of neoplasm. However, that category has several subcategories as shown. While there are 2 valid conditions with risk adjustment value, only the one with the greatest hierarchical rank will be included in the risk score for the patient. That would be HCC 8. Therefore, HCC 8 will trump HCC 12. Note, the highest ranking subcategory is listed first in the overall HCC chronological list. Therefore, within a hierarchy, the lower the number, the higher the rank within that category. Again, HCC 8 comes first chronologically, okay, and trumps HCC 12. Let's take a look at another condition category and its associated hierarchy, and that would be diabetes. The disease category of diabetes has a hierarchy of 3 subcategories. And again, let's look at an example. On January 20th of a review period, encounter documentation from the patient's primary care physician supports the diagnosis of diabetes. On April 8th, the patient sees a neurologist, and that encounter supports diabetes with neurological manifestations since it is noted that the patient has diabetic peripheral neuropathy. Again, both conditions have a risk adjustment value. However, since they're both supported within the same data collection period, the diabetes with neurological manifestations will trump the diabetes without complication. That is, the diabetes with chronic complications, HCC 18, will outweigh or trump the diabetes without complications, HCC 19. Let's take a quick review. 25 condition categories divide further into 79 hierarchical condition categories. The 25 categories or their subcategories do not trump or supersede each other and are additive, meaning that they will add together to calculate a beneficiary's overall risk score. And we will take a look at this in a moment. One or more conditions that fall within the same category that is divided into subcategories are counted only once and according to the rank of the conditions within that overall category. The most significant condition in that hierarchy will be factored into the risk score. So let's take a look at these two examples together. The beneficiary has neoplasm and diabetes as illustrated. Again, the records for this beneficiary record the following. On March 12th, the record for the patient indicates the patient is being treated for prostate cancer. That would be ICD-9 185, mapping to HCC 12. On June 16th, the patient was diagnosed with metastatic lung cancer, ICD-9 197.0, which is mapping to HCC 8. On January 20th, encounter documentation of the patient's primary care physician supported the diagnosis of diabetes, ICD-9 250.00, which maps to HCC 19. And again, on April 8th, the patient sees a neurologist, and that encounter supports diabetes with neurological manifestations since it is noted that the patient has diabetic peripheral neuropathy, and the coding scenario for this would be ICD-9 250.60 as well as 337.1, and this will map to HCC 18. There are two condition categories, two of the 25 categories, neoplasm and diabetes, that will each represent a risk adjustment factor. In this example, each of the two categories have more than one diagnosis with a risk value. Again, only the most significant risk value from each category will factor into the overall risk score. So on the left, we have the inset that shows HCC 8 trumps HCC 12 from the neoplasm category. And on the right inset, we have HCC 18 that trumps HCC 19 in the diabetes category. What is the final risk score impact of this scenario? With the single representative diagnosis and HCC identified from two categories, that would be neoplasm and diabetes, through trumping of the neoplasm HCC 12 by HCC 8 and diabetes HCC 19 by HCC 18. Now we have two distinct categories to factor into the overall risk score. And just for review, the risk score formula is diagnoses, HCCs, plus demographics, plus interactions equals the overall risk score. Assuming no other conditions for this beneficiary, this would be an additive calculation of 2.484 plus 0.368 for a HCC risk score of 2.852. which would be then added to the demographic value for a total risk score. There are no disease interactions to be factored in this scenario. The risk score is then multiplied by the base rate to determine the PM or per member per month risk-adjusted premium for this beneficiary. Let's take a final review. Again, there's 25 categories that are expanded into 79 HCCs. Categories with subcategories establish a hierarchy. The most significant subcategory in a hierarchy trumps others in that hierarchy. And chronologically, the lower the HCC category number in the hierarchy, the higher the value, and that would be the most significant condition or HCC for that hierarchy. We thank you for joining us for trumping in risk adjustment and HCCs, and we invite you to join us for complete risk adjustment training and certification preparation in risk adjustment. And you may visit us at www.compliantcodingsystems.com or compliantcodingsystems.learnupon.com/store for registration. Again, thank you for joining us today, and we hope to see you again soon.